Chlamydia is a common sexually transmitted infection. If you've engaged in unprotected sexual intercourse with an infected partner, you're at risk of contracting chlamydia. Want to learn more about chlamydia? Keep watching as we'll break it down here. So, let's talk about sexual health.
It's not my fault.
My name is Dr. Hart-Pinto, and in this series we aim to break down the social barriers to sexual health. At JHP Medical, we make weekly information videos designed to increase awareness and help you better understand your medical condition. So if you find this video helpful, subscribe, click the notification bell and the like button to support us in helping you. So what is chlamydia? Chlamydia is one of the most common sexually transmitted infections in the UK. Chlamydia trachomatis, the bacteria that causes chlamydia, spreads through unprotected vaginal, oral or anal sex. If left untreated, chlamydia can cause serious problems for both men and women. Amongst men, the infection can spread to the testicles, causing pain and swelling. And for women, the infection can progress to pelvic inflammatory disease, PID for short. PID can lead to persisting abdominal pain and long-term fertility issues, meaning you may experience difficulty getting pregnant in the future. Fortunately, these complications are avoidable with early diagnosis and treatment of chlamydia. Symptoms of chlamydia normally develop a few weeks after unprotected sexual intercourse. The top 5 symptoms of chlamydia experienced by women are pain when passing urine, unusual vaginal discharge, pain during sex, bleeding between periods or after sex, and pain to the lower abdomen or pelvis. Men also experience symptoms of chlamydia infection. Amongst men, the top symptoms are pain on passing urine, unusual discharge from the tip of the penis, testicular pain, and urethral itching or burning. Depending on your choice of intercourse, you may experience symptoms in other areas. You may experience discomfort or unusual discharge from your bottom, where you've engaged in anal intercourse. If you've engaged in oral intercourse, you may also experience symptoms of sore throat. Most importantly, chlamydia doesn't always cause symptoms if you're infected. At least 70% of women and 50% of men infected with chlamydia trachomatis are asymptomatic. If you're concerned about sexually transmitted infections, please get a test from your doctor or local genitourinary medicine clinic. So should I get a test? If you're experiencing any of the symptoms discussed or have engaged in intercourse with someone potentially infected with chlamydia, you should get tested. Testing for chlamydia is painless, quick and easy. Your doctor may choose to obtain either a swab of discharge from your penis, vagina, bum or throat, or a urine sample. In England, current recommendations are that all sexually active people under the age of 25 should receive annual testing under the National Chlamydia Screening Program. Testing should also take place if you change your sexual partner. So when will I receive treatment? If you have symptoms or signs strongly suggestive of chlamydia, your doctor may commence treatment at the first consultation. Otherwise, you'll only receive treatment after a positive test. So what treatment will I need? You'll be glad to know that chlamydia infections are easily treatable. If your doctor identifies you require treatment, they will prescribe you a course of antibiotics. In the UK, the antibiotic of choice is doxycycline 100mg taken twice a day for 7 days. However, this may differ depending on your location. If you receive antibiotics, you must complete the entire course, even if you're starting to feel better. What about my partner? Do they need to be treated? Importantly, once you've completed treatment, reinfection is still possible. Therefore, your partner must receive treatment also. It is advisable to avoid sexual intercourse until you have completed your treatment. If you have multiple sexual contacts, it's important to engage with contact tracing. Your local genitourinary medicine clinic can assist you with this. Without early diagnosis and treatment, other individuals may become infected. Delayed treatment may result in long-term complications for them also. How can I prevent reinfection in the future? One simple way of reducing your risk of contracting chlamydia in the future is to use barrier contraceptives, like the condom. I hope you've enjoyed this video. Don't forget to subscribe and interact by giving us a thumbs up or leaving a comment down below. This supports the growth of our channel and helps educate many more people about their medical conditions. Of course, this video does not provide individual medical advice and is intended for information purposes only. Do not consider this as a substitute for professional medical advice, diagnosis or treatment. Please don't ignore professional medical advice or delay seeking treatment because of something you've heard here. If you believe you may have a medical emergency, immediately call your doctor or ambulance service. Thank you for watching. See you next time.